In today's movement tip, we're going to talk about what an exercise that the Mayo Clinic has identified is the #1 exercise you can do to prevent disease, to also increase longevity, and to keep you mobile and youthful for a long period of time. So that's the squat. Now, a lot of people hate the squat because it causes them knee pain or back pain. And I'm not talking about putting a bar behind your back. But again, think about it. When we get in and out of cars, we get in and out of chairs, we are squatting. And we're turning our bodies in different ways. So if we want to think about this in a three-dimensional way, we want to adjust our feet either forward and backwards, side to side, or rotation, or any combination of. And the more variety you actually have with your foot position, it's actually going to not only decrease your risk of injury, it's going to make your body more balanced and holistic, but also it'll just help you in everyday movement. So think about it. I had a basketball player who hated to squat. And we just talked about, let's look at your videos and see how you land when you rebound. And never did he land with his feet parallel. So sometimes they were toed in with one foot in, and he rotated when he landed with the rebound. Sometimes it was toed out. So think about all these different varieties. So you can carry a piece of equipment. Medicine ball is a great way to start. And just think about adjusting forward and backward first, just a couple of inches. I'm going to go at an angle, so think about the back heel as your foundation. So we want to stay down in that back heel. You can rotate left, you can rotate right, you can extend out, all different varieties. And then do the same thing with the other foot forward. Extend, rotate left, rotate right, and extend out. Now we can go wide, and we're going to externally rotate. So I'll put the right foot forward. Again, I can go down and overhead. And I'm just showing you a variety of things you can do with your hands and with the weights to make the body more holistic and again more balanced, so you have less injuries, feel more youthful and more athletic. Just all different kinds of varieties. And then you can even go narrow and toed in, right? So I'm just kind of thinking as many different ways as I can come up with squats, and the more variety the better. All right, and then just switching feet, same thing on the other side. So there you have it. Be as creative as you want to. Use whatever equipment you want, but make sure you're squatting at least every other day. We have beginners start with just 40 squats a day. Any equipment or just using their body weight, but get squatting. Think about keeping the heel of the back foot on the ground. That's your foundation. Go whatever range you feel comfortable. You don't have to go all the way down, but eventually you want to get to a point where you can go even below the knees or the hips, because that's real function or ideal function. So there you have it. Start squatting today and enjoy.